I'd like to say to anybody who's listening to this who has dealt with Lyme and is maybe currently struggling with it, like, there is hope. You don't have to stay stuck in that. Make sure you're working with someone who can use the high-powered tools that will actually suppress it.
Yep.
In my opinion, it's not something you're going to do with supplements.
Welcome to the Longevity Unlocked podcast. We are your guide to optimizing your life one health tip at a time. We are not providing a replacement for medical advice. Please always consult your doctor before making any diet, exercise, medical, or lifestyle changes.
Ladies and gentlemen, welcome to the Longevity Unlocked podcast, officially branded. So we're full send on unlocking longevity, and today's topic is something that is kind of, somewhat controversial in terms of how to actually affect change, but it's Lyme disease.
Yeah, it's like the most traditional versus alternative thing out there. Versus your insurance company. We'll bag on them a little bit.
So let's start with what is Lyme disease, and then we'll go into how do you test for it.
So Lyme disease is a spirochete.
Is a what?
It's a type
a
of bug.
parakeet?
A spirochete.
Oh.
It's a type of bug
Okay.
that causes an infection. But really, it causes an infection, but also it suppresses your immune system. So then other bugs jump on board. And now you have Lyme, plus a bunch of other garbage.
It's like a parasite?
Technically, I think it's a bacteria.
It's a bacteria.
I think so. But it's a bacteria that acts as a parasite.
Like a virus?
No.
It's a thing.
It's just a thing. It really is its own special and unique category. When you really look at how it acts, it's its own thing.
Wild. Okay, so basically it is this bug. We're going to call it a bug. I like that.
Sure.
That takes your immune system out.
Crushes your immune system.
So it's like the bug version of HIV.
Sure. So Lyme, where do you get it?
Ticks.
Ticks.
Yeah. Outside.
Well, technically, it's transmissible through human bodily fluids. Technically, it's an STD.
It is the bug HIV.
I
didn't know that.
Yeah. So yes, ticks is how it's known for, but it's because they bite and infect the person. Then now the tick carries Lyme. Ticks are immune to it. And then they bite other humans and spread the Lyme.
Okay.
So in theory, and this is just a theory, no one's proven it yet, mosquitoes can transfer Lyme. Because again, blood.
Like malaria.
Yep. And then there is thought process that it really is an STD that it can, human to human transfer can happen. The only one that's proven is ticks.
Okay. So that's how you get it. Just don't ever go in the woods. How do you prevent it if you are actually going outside? Is there any good way?
I mean, yeah, there's clothes you could wear. It's long sleeves. It's pants. Everyone from up north knows this. It's pants with your socks over your pants. It's boots, long sleeves, a hoodie if you're really walking through the woods. But really just don't expose any skin and check yourself regularly. And as soon as you get home, you check yourself A to Z. Have a friend check you.
Okay. So if you catch it early, can you kill the thing?
In theory, the tick releases the Lyme disease so ticks, they release saliva so you don't feel them releasing their bite. And so it's when you get it. So if you get the tick off before it releases, in theory, you won't get the transference.
Okay. Very theoretical.
Very theoretical.
Okay. That's a little bit of a left turn. How do we test for it?
Well, by the time you're testing for Lyme, it's too late. You already have Lyme.
Okay.
So doxycycline, this is my opinion. Different people have different opinions, but here's my opinion on doxycycline. If you don't have doxycycline in your system, by the time the bullseye rash appears, it's too late.
What is doxycycline?
The antibiotic that people take to try and kill the Lyme disease before it becomes systemic.
So basically, you're in the woods, you get bit by a tick, you get the thing off, you immediately call your urgent care or whatever.
Yep.
And doxycycline.
The problem is if you go to your traditional doctor, they're going to say, do you have the bullseye rash? If no, you don't need doxycycline, you're fine.
Okay. So you ask for it, you demand it.
Try.
Yeah.
Find somewhere
Do
to
you
get
call
it.
the longevity center?
Call the longevity center. But really, that's it. If you don't have it basically on board, if you don't have doxycycline within 48 hours, it's probably too late.
Okay.
That's my opinion.
So most people are not going to hit that window.
No.
They're going to end up with the bullseye.
Yeah.
If you have the bullseye, or if you don't have the bullseye, could you still have the Lyme?
Yes, because you could have a bullseye on your scalp. You could have it somewhere else in your armpit, and you'll never see it, but you had it.
Okay.
So here's the typical pathway for Lyme. You get bit by the tick, you think nothing of it. A couple weeks later, you get really sick. You don't make the connection, but you're sick for like a week or two. You think you have the flu, it goes away. A year later, you start feeling bad all the time. And that could last anywhere from like a couple weeks to a couple years. And then most patients, it will go into remission at that point and then reappear in like 5 years and affect your heart and mess up your heart. Again, go after usually a few years and then reappear around year 10 to 12. And that's when it messes with your nervous system. And then that's when it just becomes fully chronic.
So this is a massive like whole body condition.
Yes.
And probably life altering for
Yes.
people who especially get bit young.
Yes. So Lyme is known as the great imitator because it can present with so many different things. It's really hard to diagnose.
Oh.
The one thing I have noticed with Lyme, it's the pattern of speech. Like Carly, our patient coordinator, she can spot Lyme patients on the phone. Even before they say they have Lyme, she can tell because of the pattern of speech because she's talked to so many of them. I can, once they appear in the office, I can look at them and be like, the way you talk, it's just something off about it. And it's almost always Lyme.
And that's just the practitioner and experience
Yeah.
thing. Okay. So how do we test for it?
So you can go to Quest or LabCorp and do a test for Lyme. Almost always negative unless you're in a massive acute flare-up. And then there's a couple specialty companies out there. The two most popular ones are Vibrant and IGeneX. You can test for Lyme through a cheap way called a Western Blot, or you can test for Lyme through an ELISA PCR and autoimmune IgG, IgM antibodies. Guess which way Quest and LabCorp use?
Western Blot.
Yeah.
Cheap way.
Much less sensitive. Really only picks up acute infections.
And do you get false positives and false negatives on that test?
No, if they manage to catch it, you definitely have Lyme.
Okay. Just false negatives, basically.
Yes.
Okay.
Because the amount of patients I've had that Quest and LabCorp is negative, I'm like, I think you have Lyme. Let's do the Vibrant testing. We use Vibrant. Vibrant and IGeneX have a very similar panel. Vibrant's just cheaper. But we use Vibrant testing, and they have chronic Lyme out the wazoo.
Okay. So your standard blood tests that are relatively affordable, like, cash based, probably like $100, are not
No,
accurate.
no, unfortunately not.
So you think you might have it. You can do screening with a Quest or a LabCorp.
Mm-hmm.
If you pop up positive on that, you definitely got it.
Yes.
If you pop up on negative, work with a practitioner who might give you the Vibrant test.
Yes.
Okay.
But the rewind. If you get bit by a tick and you're not sure, save the tick. Put it in your freezer and save it. Because you can test that tick a year later.
Wild.
Mm-hmm.
Who does that?
There's labs that will test the tick.
Tick testing.
Yeah. I wouldn't be surprised if ticktesting.com was a website.
That would tick me off.
But yeah, so you can get the tick tested. That's easy.
Where are we going from here?
So that was testing. Now treatment. Treatment is the whole wide range of what to do. So if you go to your traditional doctor and say, hey, I got bit by a tick, I had the bullseye rash, and now I feel horrible. They're going to do they might just give you antibiotics. It's 30 days of doxycycline. They might do the Quest LabCorp testing. If, in my opinion, and everything I've seen, the doxycycline will work for like 6 to 8 months and symptoms will come back. It will suppress it temporarily, but it will always come back, and it messes up your gut in the process. So if you're going to prevent Lyme, but it's going to mess up your gut, fine. But if it's going to mess up your gut and just buy you 6 months and you're back where you started, now you're actually worse off because now your gut's messed up.
Makes sense.
So then you get into all the people like me. And we view Lyme, I tell patients all the time, we'll never fully get rid of your Lyme. We can't. All we can do is suppress it to a point that doesn't affect you day to day. But it can flare up at any point in the future. And then you have to suppress it again.
So basically it is something that you just got to be on top of.
Yes.
How long does it take to suppress?
Depends on the person. Sometimes a month, sometimes a year. The way I view it, Lyme loves friends. That's its thing. It loves heavy metals. It loves molds, parasites, bacteria, viruses, You name it, it loves it. So what I found is if you attack Lyme directly, again, you'll suppress it similar to doxycycline, but it'll be back. You have to kill all of its friends. You have to chelation, get rid of the heavy metals. You have to do parasite treatments. You have to do mold treatments. Once you've taken away all of its friends, it becomes much easier to suppress. And we do it with ozone, methylene blue, CBD, and other IVs.
Okay. So say I get bit by a tick, but I am otherwise perfectly healthy.
Yep.
I have no heavy metals. I have no mold. I have no parasites. I am perfect.
Yep.
Is that still going to probably wreak havoc on my system, or is my body just most likely going to handle it?
I think you'll handle it because I think there are patients walking around with Lyme, or people, they're not patients, they're just people walking around with Lyme that have no idea because
they're just pretty clean.
Yeah. And so the Lyme doesn't, I mean, at some point it's probably lowering their immune system a little bit, but going from 100 to 90 is way different than going from 60 to 30.
Yeah, that makes sense. So in terms of protocols, do you want to get into like how to do it, or is it so patient specific that
it's a little bit patient specific?
Okay. Moral of the story is you got to work with someone who knows what they're doing, and
Yes.
you remove the co-infections. They're not all infections, but co-problems
Yes.
and toxicities before you directly confront the Lyme.
Take away Lyme's friends.
I like that. Take away Lyme's friends. That's a good one.
Yeah.
Anything else you want to share?
Probably, but
I got a few things.
what?
I'd like to say to anybody who's listening to this who has dealt with Lyme and is maybe currently struggling with it, like there is hope. Like you don't have to stay stuck in that. Like some of the results we've seen on the pre and post testing and the subjective in terms of how people are feeling and the symptomology is just, it's like why we do what we do. The vibrant testing, you know, we've had it come back after a protocol, you know, it's fully suppressed. There is hope and there is a way to do it. Make sure you're working with someone who can use the high-powered tools that will actually suppress it.
Yep.
In my opinion, it's not something you're going to do with supplements.
No, I was just about to say, supplement-based Lyme therapy, you're going to be doing it for the next 20 years.
Yeah.
And you're going to feel miserable the whole time because you're constantly cranking on the Lyme. Your immune system's constantly attacking it, which makes you feel bad. And you're never killing it. You're just fighting with it.
Yeah. So you need to work with like a integrative practice who can use the heavy duty, like aggressive techniques and get it done if you don't want to be fighting this forever.
Yep.
Okay. Well, ladies and gentlemen, this was Longevity Unlocked. We talked about Lyme disease, where you get it, how you get it, how to prevent it when you're in the woods, testing, and how to suppress. Thank you for joining us. I'm Coach Kyle.
Dr. K, we'll see you guys next time.
This podcast is not medical advice, and any information taken from this episode should be discussed with your medical provider and not be a replacement for a consultation. We disclaim any responsibility for any possible adverse effects from information taken from the episode.